Good morning, everyone, and thank you for joining this morning's webinar. Just going to give it another minute or so just to make sure everyone who wants to join is able to join this morning, and then we'll get started. So yeah, we'll be with you shortly. Okay, we'll get cracking then. So good morning, everyone, and welcome to the fourth Essex Health Series webinar, which is going to focus on the understanding the impact of COVID-19 on those who face barriers to being physically active. As I said, this is the fourth webinar in the series, and I'm really pleased that you're able to join this morning's webinar. We've got some fantastic speakers again lined up for you this morning, and I will introduce them shortly. But I just wanted to quickly touch on some training that we've also got available. So we've got some mental health training available, and all of the information is available on our website if you're interested in mental health first aid training, and a COVID rehab course as well. So please do have a look at that. As I said, we have some really great speakers lined up for you this morning. And the first speaker that we have is Nicola File from the Activity Alliance. And Nicola will be speaking shortly to really set the scene and the context behind a recently published report that the Activity Alliance have done looking at COVID-19 and disabled people. And then we've got Lindsay Barrett joining us from Sport for Confidence as well. And Lindsay is a friend of ours at Active Essex and has been working in the county for a number of years within leisure centres. And Lindsay will be talking about Sport for Confidence, the programme that they have, and is joined by Donna as well. And Donna will be speaking shortly as well. So without further ado, I'd like to introduce Nicola File from the Activity Alliance. So welcome, Nicola. Thank you for joining us this morning.
Oh yeah, thanks so much, Kelly. So I'm going to share my screen if that's all right. There we go. So fingers crossed that's all working for everyone. If not, give me a manic wave, and I hope you'll be able to see it. So yeah, thank you very much for having me today, guys. As Kelly said, my name's Nicola. I work for Activity Alliance. I'm one of our engagement advisors that sits within the engagement team, and I cover the East and Southeast regions, so that's why you've got me today. We are a national charity, Activity Alliance, and a membership organisation, and we work really closely with people like Active Essex and Sport for Confidence to really kind of drill down and understand what's going on a local level. We recently released our new strategy a couple of weeks ago now, and that's titled Fairness for Disabled People in Sport and Activity. It's no secret that disabled people participate less than non-disabled people, and they are also twice as likely to be inactive. So we call this the fairness gap, and we aim to close this gap within a generation by focusing on these two key goals, which are, number one, embedding inclusive practice into organisations, and number two, changing attitudes towards disabled people in sport and physical activity. As Kelly alluded to, I'm going to be presenting some data from our annual disability and activity survey that the data was released at the beginning of this year, but the data was actually collected in September, October time last year, which was actually a really interesting time within the pandemic, as we just kind of come out of the summer where things were looking a little bit brighter, and things were starting to go in the wrong direction again, as well as data that we've collected. I say we, the royal we, it's very much our wonderful research team within Activity Alliance, from Sport England data, as well as the Office for National Statistics data, as well as other sources across the last 18 months plus. So yeah, it's quite stat heavy, but that's why we've got the wonderful Lindsay and Donna here as well to really put that local level spin on it, to kind of drill down into some of the more specifics. So I love data though, so this is my favourite thing to do. There was some good news prior to the pandemic. Activity levels were increasing amongst disabled people before March last year, and that's the first time we've seen that in, well, forever really. So it was really good news. But we do know that disabled people were still twice as likely to be inactive as non-disabled people, but we were starting to make a difference. And I say again, we, the royal we, all of you wonderful people on the call, are the ones that are helping to make that difference. We know that actually the most popular activities for disabled people to participate in were walking, fitness activities, so going to the gym, and then cycling, swimming, and then fitness classes as well. So they were the most popular things for disabled people to do, and that was a similar picture for disabled and non-disabled people too. So that inclusive model of getting people active together would definitely be suitable for a majority of activities. So as I said, our annual disability survey, we've done 2 of them now, so it's our second round of data that we're presenting today. And yeah, it's a fairly new thing for us to do, but it's been so helpful, especially over the last 18 months with the pandemic. So was there a poll actually? Have I forgotten? Did you want to do a poll, Hayley or Kelly at all? Because I'm going to present the answer to the poll if we're not going to do it in time. Sorry.
Yeah, Mel, can you do the poll for us, please? So yeah, just to add, so as it says, as of the 1st of March 2021, according to the latest Sport England coronavirus data, what percentage of people in England classified themselves as active? So that's meaning that they do 150 minutes plus a week of physical activity. Okay, so the results are in, and 43% say 17%, 33% of you think 23%, 14% said 29%, and 10% said 43%. So I'll leave Nicola to reveal the answer.
Oh, thanks. So yeah, the answer there was B, if I'm not mistaken, 23%. So here we've got a nice little graph table showing activity levels throughout the pandemic. So it's starting in April last year. If you can cast your minds back to April and May last year, it was much sunnier than it's been for the last month or two. We had glorious sunshine. And for me anyway, the pandemic was a little bit novel at that point still. Things were brighter a little bit. We were being told that we were meant to be exercising. That was the one thing we were allowed to go outside to do a day. So things were very different. So there was actually a very slight increase in activity levels for disabled and non-disabled people for April and May last year. Then we move on to October, things starting to go a little bit more pear-shaped, as it were. We had the new Kent virus. I live in Kent. I'm over the bridge for you guys. So we had the new Kent virus. We've got to really start our own thing over here. And that was really, really kicking up, getting going. So things massively plummeted. Weather was turning bad again. Darker nights were coming in. So levels did massively drop. Then a little bit of an increase again towards the second lockdown. We were seeing some improvements and motivations for disabled people, but there were still concerns about exercising, and actually across all of these, the inequalities did continue. It was still lower for disabled people than non-disabled people. And then the latest data we have is from February to March this year, when again, there was a little bit of a glimmer of hope. the lockdown roadmap was released, so we could see how the plan was to get us back out of this. We were allowed to start thinking about putting on outdoor activity for children again, and you know, we could see the plan and how it was going to unfold. So activity levels were improving for non-disabled people, but not at the same rate for disabled people. So that's your little kind of timeline graph of how activity levels have changed over the last 18 months or so. Not quite 18 months, but it feels like it, definitely. So what we do know is that disabled people are still less likely to feel that they have the ability to be active because of coronavirus. So just over half feel that they've got the opportunity to be physically active, and that's compared to almost 3/4 of non-disabled people. And the worry about leaving home to be active is much higher for disabled people than non-disabled people too. Disabled people are less likely to have found new ways to be active during the pandemic, for whole various different reasons that I'm going to come on to on the next slide. And they're less likely to be using exercise to manage their mental and physical health. And we know how important that's been over the last 18 months, sorry, and also to have time for physical activity. It was something that at the beginning of the lockdown, that a lot of non-disabled people were thinking, oh, we've got more time, I don't have to commute, all these, you know, extra things where you've got the ability to have extra time. And that's just not the same for disabled people that we found across all this data. So what we do know is that there's been a huge amount of new barriers created for disabled people because of the pandemic. And it's really important to consider these when planning to kind of reopen and to introduce new activities, and really just consider how these barriers are going to be affecting people right now and in the long term as well. What we can see, so these are the ones that are more affecting disabled people than non-disabled people. There are also barriers that affect disabled people and non-disabled people similarly. So they are things like closure of facilities or public transport, or things like that are you know, across the board. But these are the ones that are specifically impacting disabled people more. And the top one, I don't think is any real surprise, is self-isolating at home. That is a huge difference between disabled and non-disabled people, and is definitely the top barrier. We know there's more disabled people that were self-isolating than non-disabled people, and actually just because we've been told that you may not need to self-isolate anymore doesn't mean that people feel confident to not do that. They may well still want to be self-isolating because maybe they can't get the vaccine, or they're just not comfortable doing so at the moment with maybe the new variants that we're seeing as well. So yeah, do consider people that are still self-isolating, and that is more likely to be the case for disabled people. The fear of contracting the virus is also far greater for disabled people than non-disabled people. Impact on physical and mental health. We know there's been a huge amount of deconditioning over the last 18 months because people haven't been able to access their usual activity, or they're not able to go to usual appointments or physio or hydro sessions or whatever it might be. So there has been a huge amount of deconditioning going on. And it's really important to consider that if maybe you do some falls prevention work, and actually we're expecting to see a huge amount of falls prevention, kind of an increase in that work in the next little while because of the pandemic. Fears of being unable to socially distance. Again, this probably correlates back into the fear of contracting the virus. Maybe the activities that people are putting on, they're not confident that people are going to be able to socially distance effectively. And a lot of this, there's a common word in a couple of these, which is fear, and it's really important to understand how fear across the board can be really just really impactful, and we need to make sure that we try and alleviate as many fears as possible. And I'll come on to some of our recommendations for that too. A lack of space at home can also be a big one that affects disabled people more. Having less support from family, friends and carers, maybe because of their need to self-isolate. They weren't comfortable with people supporting them in the way that they normally would do, or they weren't able to do so for various different reasons, as well as not having the right type of support, not knowing how to exercise maybe safely at home. Maybe they didn't feel like they were able to do so in a safe way for them. They were worried about getting hurt. and the effect of coronavirus on their benefits as well. So that's really understanding the individual as a whole. So we know that a disabled person is, as a person has got a whole host of things that are important to them, and actually they're more likely to be in a lower socioeconomic group. They're more likely to kind of live in larger households, and there's lots of things like that that, you know, really understand the individual. And also just not knowing how to access online sessions. The digital divide has been huge. You can see that disabled people are less likely to be able to access kind of internet connections and have iPads or whatever it is to get online and do these sessions too. So loads and loads of things to think about and understand how we can kind of help to combat these barriers as we move into the next stage of unlocking. So one thing that Hayley did really want me to kind of touch on was around how we communicate and how we've been communicating over the pandemic. So we do know that disabled people were more likely to feel they didn't have enough information on how to be active, and that's almost twice as many said they didn't compared to non-disabled people, which is, you know, a huge amount. We tracked what sources of information people use to get information about how to be physically active. So almost all sources saw a fall in use, except for social media. So this probably reflects the change in circumstances. So, you know, libraries and sport and leisure clubs being closed, that would probably be used more previous to the pandemic. Websites, medical practices, and, you know, GPs, medical professionals, as well as family and friends are the top sources. And I think that we all know that's because they are the trusted individuals. They're people that disabled people do trust and know that are going to be working in their best interests. So yeah, really, really key on the health professionals there as the preferred source of advice about physical activity. And actually disabled people are more likely to listen to the government and friends. So maybe that's why we did see that slight increase at the beginning of the pandemic when we were told to go outside and get our daily exercise, which kind of tailed off as the months went on. So yeah, there's a huge amount of information about communication that we have on our website. So if this is something that you wanted some more information on, please let me know, and we can kind of get that sorted, and maybe kind of do some more work on communications if that's something of interest to you guys. So physical activity for disabled people after lockdown, which is kind of where we are now. We're on the way out. Fingers crossed. And it is good news. Disabled people do want to be more active after lockdown. So the want and the need is there. It's almost 8 in 10 disabled people say that they want to do more physical activity. And that's compared to 57% of non-disabled people. So there is the want and the need there. We just need to get the basics right to make sure that people are comfortable being active and stay being active. And there's a whole host of activities that people intend to do to be active once we're allowed to. And actually, I think all of these activities are now allowed in the current stage of the roadmap that we are in, which is good. And this is similar for non-disabled people too. So the top activities that we know that people want to do are swimming, or indoor swimming. I'd like to do outdoor swimming personally, but no, indoor swimming on this one. Indoor gym, team sports, outdoor activities, like, you know, hiking and that kind of thing. Combat and martial arts is quite high up there as well, and then mass participation events as well. So one other thing we do know is that people with mental health conditions are more likely to say that they intend to take part, and people with physical impairments are less likely. So actually we need to consider why there's a difference between those two impairment groups, and maybe it is that kind of, you know, is there going to be the accessibility is going to be right for people because of the new, you know, the new regulations that are in place. Is the accessibility actually going to be a big thing for people with physical impairments? So last up for me, I think is, oh no, got another one. Sorry, then I've got my conclusions last. We still know that disabled people are likely to face more challenges to taking part. And they're still the ones that were faced by disabled people during the pandemic, and they're still going to be here moving forward for the foreseeable future. So as I said, strength has declined, deconditioning has really made a huge difference for disabled people. Physical capacity and physical capacity and fitness to undertake most activities has decreased compared to this time last year or a little bit earlier on this year. And even though we have got the vaccine, and as I turned 30 last week, I've now booked my jab and I'm very excited to have it. But the vaccine rollout is having a positive effect, but less so for disabled people. So there is, obviously some worry still around being active, even if you have got the vaccine, but it is starting to have some sort of a positive effect. And there's a whole host of challenges for actually the organisation and sports clubs and whoever is delivering that activity. Maybe it's actually the loss of confidence in how you're going to support disabled people if you've got to face all of these regulations and everything that is in place. And obviously, as a sports club, you're going to be looking for safety and risk, and you want to make sure that you're getting it right. So do please get in touch if there's something that we can help with. I'm sure the guys at Active Essex are happy to help as well. So yeah, please do let us know if there's any questions or queries you have, and we can help point you in the right direction. But I'm going to come on to some resources that we have on the next slide as well. So finally for me, to kind of wrap it up and to give you some kind of top tips from us. As I said right at the beginning of this, before the pandemic, there were real positive changes happening for disabled people, with more people being active and perceptions were changing. However, the pandemic has disproportionately affected disabled people in a whole host of areas, and we've seen that progress has halted, even declined, and we all need to take some action to make sure that this doesn't continue in the long term. So we have 5 recommendations that we've developed with our stakeholders and our research impact group as well. So the first one is providing information. So there's been a lot of confusion for both organisations and individuals themselves. So as an organisation, you need to be supported, really, to be able to confidently provide the right guidance for and for your participants, to help to reassure them that being active can be safe and as risk-free as possible. And honestly, the best way to do that is to listen to disabled people themselves, listen to their concerns, listen to their worries, and try and address that. We've got our reopening activity guide, as well as all of our inclusive communications guidance. And if that is something that you're interested in, I can make sure that we can send out information after this via the guys at Active Essex. The second one is to embed inclusive practice. Inclusion really does need to be at the heart of our redevelopment after all of this, and it's a lot easier to build inclusion in from the beginning rather than trying to tag it on at the end. So really use our 10 principles, our training programs, our inclusive activity program. We've got some learning from Get Active project as well. And if your organisation really wants to deep dive into some work, we've got some kind of inclusion across the whole organisation work that we can do too. Number 3 is work collaboratively. Kind of being on this call shows that you're part of this excellent network that Active Essex has, and actually sharing information across all of you guys and via Active Essex will be really, really positive. And it's hugely important, particularly when we're talking about health and community organisations. So the government itself also has a huge influence on this. So we're doing our part to kind of lobby government and to make sure that we do share learning and best practice across as many organisations as possible. Number 4 is offering a variety of ways to be active. One thing the pandemic has definitely done is kind of kick-started everyone's digital revolution, as it were. And even though being online isn't perfect for everyone, it is, but it's some people's preferred way of being active. So hopefully you can see that there is no one group of disabled people, and that there is no one answer on how to help disabled people to be more active. There are still preferences, whether it's staying home in your living room and being active on Zoom, or going to the gym, or going to your hockey club or whatever it might be, or even just going for a jog outside and feeling safe. So we need to really appeal to those individual motivations, which may well be socialising, which has been something that we haven't been able to do very well for the last however long, as well as managing physical and mental health, which I think will be kind of the key ones for the next little while, where it might have been actually 18 months ago, their motivations might have been completely different. And then our fifth and final recommendation is to change attitudes. So to help disabled people be fully included, we will need to continue to increase visibility of disabled people, challenge perceptions on impairments, and build confidence and competence within the workplace. And that is everything from me. There are my contact details. If anyone needs anything else from me, please get in touch, email, phone, text, whatever's easiest for you. And I will get back to you as soon as I can. But thank you very much, everyone. And I'm really pleased that we've got Lindsay and Donna here to kind of give you a real local picture of what's going on.
Thank you, Nicola. Absolutely wonderful presentation, and the data always backs up everything that we're doing. So really great to see that we've got some really good, robust data to build on, and look at what we can do and what we can achieve in the county, which is excellent. And actually, the bit that I've pulled out as well, Nicola, is that the intention is there as well to be active. And the COM-B model is something that we're constantly looking at in terms of capability, opportunity, and motivation. So, and motivation is sometimes the bit that we get stuck on, but the fact that the intention there is really promising. So if we can get everything else right, then we're definitely moving forwards, which is brilliant.
Definitely. Thanks, Kelly.
Great. Nicola's sticking around as well. So if you've got any questions for Nicola or the Activity Alliance, then please do use the Q&A chat function part of the webinar, and we'll be having a Q&A at the end of the webinar with Nicola, Donna and Lindsay as well. So, right, our next guest speakers, I'd really like to introduce Lindsay Barrett from Sport for Confidence. Sport for Confidence is a unique and award-winning pioneering organisation, really driving the provision of inclusive sporting opportunities in mainstream leisure facilities. And Lindsay and the team have a number of programmes that take place across the county in different leisure centres. So without further ado, I'll introduce Lindsay. So thank you, Lindsay.
Ian, thanks, Kelly. Morning, everybody. I must apologise because I'm currently poolside, so there is a lot of background noise, but I'm hoping you can hear me. So panellists, if you can't, just give me a nod. It's a real pleasure to be here. As Kelly said, I'm Lindsay Barrett. I'm the lead occupational therapist at Sport for Confidence. I'm joined by Donna, who is a participant for Sport for Confidence and also a volunteer. And I think it's going to be really valuable to hear from Donna about her lived experience. It's really important that we, as Nicola was saying, listen to people and really listen to hear rather than listen to speak, so we can make those changes for people when it comes to inclusion. So just a little bit of background about Sport for Confidence. So we're a team of occupational therapists based with coaches in leisure centres across Essex. If you're not aware what an occupational therapist is, we are allied health professionals. So we're part of that group of 14 allied health professionals, and we're the experts in the activity health link. So you'd normally find us in community settings, hospital settings, mental health and physical health. But where it's pretty special in Essex is that we actually have occupational therapists working in leisure centres. We have been working the whole way through the lockdown. We've been delivering crisis interventions in groups for disabled people using sport and physical activity. We've also been doing some online work as well and telephone support. I think for us as occupational therapists, the importance is in acknowledging that sport and physical activity impacts on people's occupational outcomes. So we very much use that lens of independent living and being able to engage in stuff that's meaningful to you in other areas of your life when you use sport. So perhaps not so much thinking about physical fitness, but thinking about how sport can impact on our ability to live more independently in the community. And that's one of our focuses. So just want to pick up on a few points before we hear from Donna that Nicola's talked about, and to give you some practical examples of some of the barriers that we're seeing in Essex. And the examples I really want to give you are from leisure centres. Nicola, you said a couple of times about challenging assumptions and looking at the detail, which I think is so important, because what we often see is that what looks like a good idea on paper and is discussed as a good solution for a problem, actually for disabled people, some of the details have been overlooked, and that's where the barriers just get bigger and bigger. So some of the examples to share from COVID, now we're seeing obviously new risk assessments in place for leisure centres, for different physical activity groups, for coaches, and often those risk assessments and additional layers of what is supposed to be I guess, security for people is raising even more challenges. First one to raise is about cashless leisure centres and cashless groups. 90% of the people that we work with don't have bank accounts and don't have access to bank cards. They're now completely excluded from joining any activities in places which accept cash only. You would be amazed at how difficult it is to sort out a cashless payment for somebody that doesn't have a bank card. We've come up with some ways that we can overcome it, but for a lot of people, this barrier is just too significant to even take on. And that's for carers as well as individuals themselves. So there's a lot of work that needs to be done there. The second point, just to raise briefly, is around things like one-way systems and environmental measures that are put in place to make people feel safer. But actually, for a lot of disabled people, these one-way systems are creating huge challenges, especially if you are required to park in a disabled bay so you can be nearer the activity, but your route to leave afterwards is a 20-minute walk out of the centre around the back of the car park. Again, those details I think really need to be considered. Things like people being told they need to be beach ready for swimming. If you wear pads, if you need to be hoisted to swim, if you need 2-to-1 care, then actually attending beach ready and sitting poolside is not something that is achievable for everybody. And there's a whole nother group of people that have been excluded. And the last one that I think Nicola touched on is the digital skills gap. So digital skills are not necessarily there for everybody. A lot of leisure centres now are saying app bookings only, web bookings only. A massive challenge, and that's something that can't be fixed overnight. Teaching somebody, perhaps an individual with a learning disability, how to safely, which is really, really important, use the internet and access activities via an app could take between 6 to 8 months. That's time that we don't have now when people are facing deconditioning and experiencing even more challenges in their health and deterioration in their physical and mental health. So I guess that's just 3 key points I really wanted to share. There's an awful lot more, unfortunately, but I think they're things to take into consideration. And the biggest message from us as occupational therapists is to never make assumptions, because it's not one size fits all when it comes to accessing physical activity. And that kind of leads me nicely introducing Donna, who has some wonderful experience to share with you all. So as I said, I've known Donna for a few years now. She attends Sport for Confidence sessions. She really is an inspiration. She volunteers and has many other hats as well. But Donna, I'm just going to hand over to you perhaps to introduce yourself, share a little bit more about you, and then I might ask some questions if that's okay.
Brilliant. Thank you, Lindsay. Thank you, Lindsay, and thank you everybody for having me. As Lindsay said, I'm Donna. I've been a participant of Sport for Confidence for roughly about 8 years in the physical sense, and since the beginning in the virtual sense. I'm also an active Essex Altogether ambassador promoting disability sport. This past year has had many barriers and many stumbling blocks due to the situation of COVID. For example, I was hardly ever home because I had many engagements with Sport for Confidence and Active Essex themselves, attending things that I had dates for the following year as well sometimes. So that was very hard, and I am so grateful. Web exercise programs, phone support, email support, because without that I don't believe I would have got through it. Not in a healthy way anyway. Obviously with me, I try to overcome things, but sometimes when your life has turned upside down and inside out and on its head in the space of a moment, it's really hard. It is really hard. It's really hard to actually say, well, if someone doesn't help me, I can't see a way out as well. It is really hard. And the web side of things has been amazing, and the support from Sport for Confidence before they set up was amazing. Just a little phone call to check in. I think I communicated with Lindsay a lot on WhatsApp, then she sent me mini challenges: take a photo of being outside, use your garden, can you send me a photo of you, video, sorry, of you doing exercise for something. And that was, I'm grateful for them challenges, because they brought me out of a mental slump. Because for me, as the only disabled member of my family, you don't want to put on other people around you, because they're going through stuff as well. Their life is also turning upside down and inside out and on its head. It's not just disabled people that are affected, it's their carers and support team.
Donna, can I ask a question?
Yes.
Yes. What does physical activity and sport do for you? Why is it so important in your life?
It's not just the physical side of things, it's connections with friends, it's doing something and achieving something. I mean, when I came to Sport for Confidence, I don't believe I said much beyond hello, goodbye, and I enjoyed the sessions, and that was it. But I've made new friends, I've taken on new challenges that I never dreamed that I would take on. If you did an interview with me perhaps 8 years ago and you said to me, do you think you'd be an active Essex ambassador promoting disability sport, I would have probably giggled at you and probably said some rude words. Because, and if you'd said to me, but you can do this, I would have probably told you, but I can't because of this, I can't because of that. And Lindsay is right. When I went back to the leisure centre at the ease of lockdown, there were more, not just physical barriers, but there was planning barriers as well. Like the one-way system was so hard because, for example, I could access a disabled changing room and to change into, but it is like a 30-minute walk to get back to your changing room when your body's cold, and because you've just got out of the swimming pool, so your body's experiencing the cold more severe. And they think it's all right to have one-way systems, which I understand, but you have to have staff around to help you move something so you can access your changing room quickly as possible, because a disabled person's body reacts severely to cold, and the stumbling blocks that are there in the mental sense and physical sense adds added pressure.
Yeah. And Donna, I think you've raised a really important point about reasonable adjustments, and that actually everybody has a responsibility to make reasonable adjustments under the Equality Act so that disabled people can engage in activities in a mainstream environment and be supported in the way they need to be supported. And I hear obviously what you were saying, Nicola, about fear, and there is a lot of fear around returning to activities, but I also acknowledge I think there's an awful lot of fear for the sport and leisure workforce and for coaches and for the leisure centre staff as well. And it's important to acknowledge that that fear is there for them as well, but it's going to be about collaboration and removing those barriers together to make a difference. And Donna, one more question for me, which is probably quite a controversial one, but what annoys you or irritates you most about the leisure industry and about sport and physical activity? What do you find really gets on your nerves as a disabled person trying to be more physically active?
Them not asking me how the one-way system is going to work. For example, you know, it's a fearful world when you can normally walk into this leisure centre, know you can find a bathroom as and when you need it. That for me, as a disabled person, there's things that I have to know that I can achieve before I plan the day. For example, you want to know that you can achieve getting a drink, whether that's through water fountains or the cafe itself. You want to know where your nearest bathroom is for various reasons, and to find that you can use it 1 minute and then you can't when you've got to go round the one-way system is a bit difficult, because sometimes there are limits on disabled facilities anyway. So it is really hard, and I'm one of those people that I'm happy if you're gonna take time to ask me a question or ask me for my feedback. I would be happy to sit with you all or go around the leisure centre with you all and show you what barriers people face as in the disabled community. And Lindsay's right, leisure centres can't expect people who budget to go to card payments, because there are some that have cash only because they can't budget, so their parents or carers give them a bag full of money and let them maintain the day. They budget like that because they've got no other understanding of budgeting.
Thank you, Donna. I just want to personally say thank you for you coming today to share your experiences. And I think we've talked about this before. People are experts in their own lives. I'm always wary of people to say, you know, we know what we're doing. We need to listen an awful lot more, and we need to listen to disabled people about how we can actually be better at what we do. So thank you for sharing today. And I'm sure there'll be some questions for you as well. I think that's us, but that's us, Kelly, unless there's anything else that you'd like us to answer.
Thank you, Lindsay, and a big thank you to Donna as well. Really, really appreciate your time this morning in joining us. And yeah, though, if we can just get those bits right, Donna, and actually talking to you and not making those assumptions, as Lindsay said at the start, then yeah, we can start to make some changes in people's lives for the better, definitely. I'm going to hand over to Hayley because we're going to move on to the Q&A section now. So again, if you've got any questions for Nicola, for Donna or Lindsay, or for Hayley or myself, please do use the Q&A function at the bottom of your screen on Zoom. Hayley, have we got a first question?
Yeah, we've got a question for Nicola. So where can we learn more about adapting our activities and offers to be more inclusive?
Perfect, thanks Hayley. I mean, there's a whole host of information on our website, including our reopening guide, which has got, it's full of information of how to be as inclusive as possible when reopening. And it's picking up things like Donna was saying about making sure that people understand how the one-way system is going to affect how they get to the toilet or how they get to the changing room, like things like just doing a quick walkthrough video so people can actually have some sense of what they're going to face when they get there without being kind of blindsided or have it as an unknown quantity, can be really, really helpful. So just kind of lots of tips and tricks like that are in there, but yeah, do have a look at that on our website. There's also a huge amount of information about our engagement resources, so engaging with different populations, our inclusive communications guides, and then our training as well. So we've got our inclusive activity program. There's 2 versions of that. We've got the online classrooms, which I think you want to touch on a bit, Hayley, as well as our inclusive activity program, which is online and is still currently free. And that's like a prelude to the one that you've got going on. So it's like a pre-course version, and it's a bite-sized one. So yeah, I don't know if Hayley, you want to kind of share some of the details of those courses.
Yeah, so we are currently looking to organise some inclusive activity programme online classrooms, which is great. It used to be a practical course, but it's moved online now, and actually it has created opportunities for more people to engage in that. So we're looking to run some more of those, and I think after today's session we'll share just an expression of interest. So if you're interested in going on that course, so you can express that, and then we can let you know about any courses that are coming up. And as Nicola said, there is currently a free kind of prelude to that on the Activity Alliance, or you can find it through the Activity Alliance website as well. And we'll share all the links that Nicola mentioned after as well, so you can easily find those. Thanks, Nicola.
Thank you.
So question for Lindsay and Donna: how can our club or organisation become more inclusive?
Donna, shall I go first?
Yes, please.
Okay. So I think the most important thing for me is about seeing the person in front of you, and keeping them at the heart of everything you do. So sadly, I think often when it comes to disability sport, people are quite keen to use labels, and they might see somebody with cerebral palsy, or they might see somebody with a learning disability, or see somebody with severe and enduring mental illness. And actually, the only label we need to use is people's names. And if we focus on the person and what's important to them, then we will naturally create an inclusive culture. I guess one of my tips is that you could go on all the training available there is on, say, autism, but that doesn't mean that when somebody comes into your session who might be autistic, that you have everything you need to be able to provide an inclusive session. So yes, it's really important to learn more and to develop our knowledge and skills around different disabilities. And I guess that kind of medical model approach has its place, but I think we really need to look at the social model of disability and look at people and relationships and what matters to them, and how we can actually work together with them to make that experience what they need it to be. Is there anything to add to that, Donna, from you?
No, I think Lindsay's hit the nail on the head. Don't expect anybody with learning disabilities or the other disabilities. You've done the course and you know the answers, because you don't. Every person is unique, has had so many barriers, so many ups and downs. Take time, drop paper, take time and get to know the person that's sitting or standing or any other aspects in front of you.
That's great, thanks, Donna. We've got a specific question from a netball club who have said they have a lady who has Parkinson's, and that's had to stop, what stopped her from participating. Have you got any contacts or, I guess, advice to help them try and get the lady still involved in the club? So maybe Lindsay, you might have some advice for that.
Yeah, no worries at all. I'd say contact me directly and we can have a chat about that particular situation. And like Donna's just said, then really focus it as take each case as it comes and see if we can support in any way, and how we can make that activity accessible again for that lady. I'm happy, Hayley, if you want to share my email details, we can have a conversation.
Right, yeah, no, we'll share your details afterwards, Lindsay, that'd be fun.
I'm a big netball fan as well. Very, very, so's Donna. Donna's an awesome centre. Donna's an awesome centre. I wouldn't want to take you on at centre, Donna.
Question for Donna. So what does Sport for Confidence do really well that has allowed you to continue participating during the pandemic?
They don't. Okay, what I call Sport for Confidence is a sport for sport support group, but sport doesn't matter. They really take time to get to know people as a person. So one day they might have people that want to take part in sport. They might have someone that has made a big effort to walk out the door, but has found a barrier, and they just take time to sit with you, calm you down, and bring you into sport if they feel you can and the person is coming out to participate in sport. But it's just taking time to get to know us as people and helping us achieve and reminding us how much we've achieved when we feel we really haven't.
That's great, thanks, Donna.
No problem.
So there was a comment more than a question, but I just wanted to share that because somebody just mentioning, thank you, Donna, for your contribution to today's session. If only we could clone you and be an advocate for disabled people across organisations, communities and systems. And the message of asking / consulting rather than simply assuming to know and understand is something every organisation should take on board. I just wanted to mention at this stage, we do have an ambassador programme called Altogether Ambassadors, with a number of people with disabilities and long-term health conditions, and also people who are advocates who don't have disabilities as well, who are ambassadors for that programme. And I'm sure our ambassadors, if there was any questions about how am I doing this right, how can I ask somebody with a disability about how they would like to be included in this, I'm sure our ambassadors would like to get involved and support doing that the same way Donna has shared kind of her story today as well. So get in touch with myself, I'll put details, I'll share that afterwards if you would like any additional connection to any of our ambassadors who may be able to share their experiences as well. Our ambassadors have different disabilities and actually have different experiences as well, so they'll be able to share from either a sensory impairment perspective, learning disability, physical disability, whatever that might be, so they can maybe share some information about how you can include others in activity as well. So I think that's all our questions that we have today, unless there's any others, just put them in the chat if you've got any at this time. But yeah, I think that's it, Kelly, for the questions.
Lovely. Thank you, Hayley, and thank you, Nicola, thank you, Lindsay, and Donna as well. So that just leads me to wrap up today's webinar and say a very big thank you to our guest speakers today, to Nicola, Lindsay and Donna. Really, really appreciate your time this morning. And Donna, yeah, if the one thing that we can all take away is just to talk and to listen to people and to disabled people around what their needs are, and how we can support them going forward. So yeah, thank you for your time this morning. We will be following up today's webinar with an email out to people with the slides that Nicola presented, along with the training opportunities that we have as well, that Hayley mentioned and I mentioned at the start. And we will also keep you posted. We do have a future Essex Health Series webinar that we are just working on at the moment, and we'll send those dates out to you once the date has been confirmed. But thank you all so much for joining this morning, and have a great rest of your day. Take care, everyone.